And now to our faculty speaker. I'm very honored to introduce our faculty speaker, Dr. Stephen J. Levin. Dr. Stephen Levin is an associate professor of family medicine here at Robert Wood Johnson Medical School, and he serves as the medical director of the Eric B. Chandler Health Center. Graduating from Emory University School of Medicine, Dr. Levin went on to complete his residency in family medicine at the Medical University of South Carolina. Dr. Levin truly embodies our theme of inspiration in medicine through his actions, providing primary care services to the underserved as the sole physician at St. John's Health Center for more than 20 years, focusing mainly on treatment of HIV, healthcare disparities, community-oriented primary care, and multiculturalism. While at St. John's Health Center, Dr. Levin taught residents and students interested in family medicine and served as a mentor for third-year medical students during their family medicine clerkship. Dr. Levin's leadership as an educator and community health advocate inspired Robert Wood Johnson Medical School to initiate the Homeless and Indigent Population Health Outreach Project, also known as HIP-HOP, in 1992. Dr. Levin was instrumental in the creation of Promise Clinic in 2004, and he continues to work with this organization to provide health care to the underserved of New Brunswick. The recipient of multiple awards, Dr. Levin was granted the Humanism in Medicine Award from the Healthcare Foundation in New Jersey in the year of 2000. He was also awarded the New Jersey Family Physician of the Year by the New Jersey Academy of Family Physicians in 2005, and he was also awarded the Family Physician of the Year awarded by the American Academy of Family Physicians in 2007. Please join me in welcoming our faculty leader, Dr. Levin.
After 4 years of college, 4 years of medical school, a 3-year family medicine residency, and a 1-year fellowship, it was time for me to make what seemed at the time to be the most difficult decision of my life thus far. I was looking at 2 job offers and had to choose between them. Now, the 2 offers were very similar in certain ways. They were both set here in New Jersey. They both predominantly involved patient care. They both had a component of teaching, and they were both affiliated with respected family medicine residency programs. But despite these similarities, the 2 positions were very different in terms of setting and salary. The first position was set in an urban, underserved area where I would be providing primary care to patients who didn't have other access to care. And the salary for that position was $59,000 and based on a 1-year grant, with no guarantee that there would be funding in the subsequent years. The other position was set in a suburban area, and the salary for that position was $75,000 and much more secure. Now, to put these 2 salaries in the context of today's dollars, the urban position would have been offering $120,000, and the suburban position $32,000 more, or $152,000. During my years of training, I was very idealistic. I wanted to be part of a healthcare system that treated all people with dignity and respect, and I didn't want to conform to a system that excluded millions of people from care. And I envisioned a healthcare system in which the most talented physicians took care of the most complicated patients, that is, the patients that had complex social circumstances complicating their health. And during my years of training, I had had the luxury to make most of my choices based on my value system or my ideals. I was able to choose which school I went to, which residency, which electives, and which experiences based on that value system. And that had been a successful strategy for me during my training years. But now, looking at the 2 jobs, I wasn't sure that using my idealism was the best way to make the choice. At that point in my life, I had a family to support, and I had loans to pay, and I was concerned about the salary differential. The other thing was I was concerned about the lack of security of the funding for the urban position. What if I bought a house and then the job fell apart? How would I pay the loans? How would I pay for my mortgage? On the other hand, it seemed hypocritical to me to not take the urban position. I had spent much of my training preparing myself to work in an urban, underserved area. And that way I could practice medicine in a way that was consistent with my idealism. Well, why am I sharing this decision with you tonight that I had to make 25 years ago? Well, I suspect and hope that I am not the only idealist in the room. And I'd like to make a second assumption, that not only are many of you idealistic, but that you'd like to maintain your idealism over time. That given a choice like the one I had to make, that your idealism would at least be a factor in how you made your decision. I don't think we ever consider the possibility that our idealism can weaken over time, but it can. Idealism is really something to be treasured. Ignore it, and it can weaken over time, just like muscles weaken over time if they're not exercised. And why is it that idealism gets weaker over time? Well, as idealists, we envision that things should and could be done differently than the way they're being done right now. And in doing so, we're asking other people to think about things differently and to make changes. The natural reaction of people when they're asked to make changes is to resist. And it's this confrontation between an idealist's desire to do things differently and most people's resistance to change that leads to a tension. And that tension can weaken your idealism over time. I'd like to share with you a few stories that highlight some of the challenges faced in maintaining one's idealism over time. When I was a fourth-year medical student, I took a longitudinal elective in community health, and the main focus of my elective was to study the way the city of Atlanta was screening the population for high blood pressure. I wrote a report about my findings, and in my report, I was critical about their screening program. My advisor thought that it would be a good idea and a good experience for me to present my findings to the Atlanta Board of Health and set up a meeting. Well, I didn't prepare properly for that meeting. I didn't know how the board went about making decisions. I didn't know how the board went about funding projects it wanted to do. And in my naivety, I had no idea how expensive some of the suggestions I made in my paper would be to implement. You could say that my lack of preparation led to an unpleasant experience for me at the board meeting. And that unpleasantness chipped away a little bit at my idealism. Well, another error that an idealistic person can make, we could call the offense of self-righteousness. When I was in college, I was very concerned about world hunger and participated in a lot of organizations and activities around that topic. I also, during that time, read and reread Frances LePay's book, Diet for a Small Planet. And in that book, she argued that world hunger had more to do with political forces than it had to do with a scarcity of resources, and that it took 10 food units of grain in order to generate 1 food unit of meat, and therefore it made no sense to eat meat in areas of scarcity. Well, I made some changes in myself in response to these readings. I became a vegetarian. I refused to buy or wear any new clothing as representations of excess. I criticized people who had pets. I couldn't reconcile spending money on food for animals when there were people who didn't have food. And in my ripped up clothing, I went door to door in Providence and asked people to donate money to charity, and then got annoyed when they wouldn't give me any. And probably the worst part was when I was home on holiday, visiting with my parents and their friends, I was critical of their lifestyles. My parents were very tolerant of me, and they tried to explain to me that there had always been poverty in the world and there would continue to be poverty, and that my self-righteous lifestyle changes weren't doing anything to help the people that I was trying to do something for, and that people would rather give money to a respected charity than some kid standing at the door that they don't know. Well, just as there are certain qualities which I demonstrated that do not help with idealism, there are some qualities that are essential to idealism, and one of them is courage. You may be familiar with the name Jeff Brenner. Jeff is a graduate of this medical school, and he's done amazing things in Camden and beyond Camden. Well, back in 1992, Jeff and another student, Jamie Reedy, and some of their friends had a particular concern about the curriculum here at the school. They were concerned that there wasn't enough clinical contact during the first 2 years of school, and that the medical students as a group weren't doing enough service for the community. And so they proposed starting a service learning organization that would address these two concerns. Well, they were proposing something very different, and in response, they encountered resistance from the faculty. But they were very courageous, and they continued their pursuit of faculty members that would support their program, and they rewrote their proposals until they were accepted. And as you all know, the organization that they started back then was Hip Hop, an extremely successful organization. Well, some 10 years after Hip Hop was formed, much of the service learning that they had brought to the curriculum was integrated into the routine curriculum, and students at the school were looking for another way to use their idealism productively. Manny Jimenez and several of his friends, they identified a particular concern that the clients of the Elijah's Promise Soup Kitchen didn't have a source of primary care. So they proposed forming a student-run clinic that would address that need. But of course, they were proposing something very different, something that hadn't been done before, having students run their own clinic. And they encountered resistance. And the resistance was understandable. There were concerns about liability, cost, continuity, and most importantly, concerns about the students' commitment. They were not deterred. They took a step back and spent a year doing a needs assessment. And in their report, they clearly demonstrated the need for a source of primary care for the clients of the soup kitchen. But more importantly than proving that point, they demonstrated their commitment. And since their work, as you all know, that started the Promise Clinic, which has continued to serve as an outlet for idealistic students to this day. So what I'm trying to say is that there are certain qualities that can undermine idealism, and there are certain essential ingredients to idealism, including courage, perseverance, commitment, and the conviction in one's own beliefs that are essential to idealism continuing. And because those qualities are difficult, I think it's important to have a strategy in order to maintain your idealism over time. The first part of your strategy would be to always question negative comments about your idealistic views. Let me give you an example. As an idealistic medical student, you may choose a specialty that addresses some need of our healthcare system, like primary care. Well, our healthcare system is built on a subspecialization model of care, and your choice to go into primary care would therefore be running counter to the norm and is likely to cause resistance. That resistance may take the form of statements such as a primary care provider, you won't earn enough money to pay off your loans or to live a comfortable life. That's just the kind of negative statement that you should never accept without question. You should do your own research and make sure it's valid. Another part of your strategy would be to be willing to make change in steps, make change in small steps. At Eric B. Chandler Health Center, we're in the process of transforming our practice to the patient-centered medical home model of care. You might call the PCMH model of care an idealist view of how a medical practice should be run. When we first started the practice, we looked at the long list of things that we were going to need to change, and some of them seemed completely out of reach and were frightening. So we looked for the things on the list that were smaller that we could do more quickly. And after we made those changes, some of the ones that seemed out of reach now seem attainable. And similar to this idea of being willing to do things in small steps, it's helpful to expect disappointment. In our PCMH transformation, it seems for every 2 steps forward, we end up taking a step back. But we were ready for that disappointment, and then we move forward again. The fourth part of your strategy would be to surround yourself by idealistic colleagues, a, so to speak, idealist support group. That way, when you're out pursuing an idealistic cause and you encounter negative reactions, you have a group of like-minded people that you can go back to who can validate that what you're doing is worthwhile and encourage you to go forward. And similar to that, it's helpful to have idealistic mentors, people who have proven that over the years they've been able to maintain their idealism. For my job at Chandler, it would have been extremely difficult if I had not had idealistic mentors like Drs. John, Talia, and Rogers to help me along. And if we want to complete the 360, thinking about idealistic colleagues and idealistic mentors, it's helpful to work with idealistic students. There's been nothing more important in maintaining my idealism than working with idealistic students for my career. And the final part of your strategy is to use your idealism. As I said earlier, if you don't use it, it will weaken over time. So going back to the decision that I needed to make 25 years ago, prospectively, it was very scary to me to use my idealism as a compass. But in retrospect, making the decision to take the urban position has led to me having a meaningful career and one in which I could practice medicine in a way that was consistent with my idealism. So what I hope tonight is that for the idealistic students that are here, that you'll take proactive steps to develop a strategy to maintain your idealism over time, and that you'll find the courage to use your idealism as a compass. Thank you.